Hi everyone, my name is Gospel and I am a DNP student at UMass Global. This is my video presentation on integrative psychodynamic therapy for the Nursing 642 signature assignment. Integrative therapy involves using different treatment models to complement each other in treating our clients. The three different types of therapies I will use on my patient today are cognitive behavioral therapy, CBT, emotion focused therapy, EFT, and mindfulness based cognitive therapy, MBCT. My patient is a 19-year-old African American male struggling to cope with his daily activities. He's a first-year college student who came in complaining of restlessness, irritability, difficulty concentrating, hopelessness, and easily fatigued for a few months now. The client stated that this started about 7 months ago after his cat died and has progressively worsened since then. The client denies past medical or psychiatric history, denies any home medications, denies any suicidal ideation, and currently goes to school from home, living with his parents. He also denies smoking, cigarettes, or substance abuse. CBT is a psychodynamic treatment that helps clients learn how to identify and change destructive or disturbing thought patterns that negatively influence their behavior and emotions. CBT helps the clients replace their illogical and negative thoughts with rational and positive ones. EFT is the practice of therapy informed by an understanding of the role of emotion in psychotherapeutic change. EFT is used to help clients improve their emotional awareness and adaptive emotional processing. Mindfulness-based cognitive behavioral therapy, MBCT, combines cognitive behavioral techniques and mindfulness strategies to help individuals better understand and manage their thoughts and emotions to relieve feelings of distress. This involves being present at the moment and observing your thoughts and feelings without judgment. Cultures play an important role in these therapy modalities. Knowing and respecting your client's cultural beliefs is essential, as this will enhance therapeutic relationship and compliance. Now, I'm about to begin my first therapy session with my client. Hi, Ben. I'm Gospel, a psychiatric mental health student. Do you consent to my recording our sessions today?
Yes, I already gave my signed consent at the front desk.
Great. How do you feel coming here today?
Honestly, the only reason I'm here right now is because my primary doctor recommended that I come here.
Um, um, it is normal to feel like that for the first therapy session, but this will hopefully help you overcome your feelings.
I really do hope it will help because I really do want to overcome some of these weird feelings.
Now, tell me about these weird feelings.
Recently, I've felt really bad about losing my pet cat. Since she died, I've felt irritable, I've had difficulty concentrating, I've been easily fatigued, lacked interest in doing a lot of things, and I've not really had much of an appetite.
Oh, sorry to hear about the death of your cat and the feelings that followed. Now, when did your cat die and what happened to her?
This was about 7 months ago. There was a the there was a day in the afternoon that I noticed that my cat was coughing quite a bit and scratching her body. At the time, I didn't really take it seriously, but unfortunately, later that evening, she died. Ever since then, that was when I experienced having these weird feelings.
Do you feel that you would have done anything differently to save your cat?
No, I think it was out of my control, but at the same time, I still have this intense guilt that weighs down on me. And at the same time, my parents have also been telling me that I don't do enough around the house. They blame me for not doing what I was supposed to do, such as helping with cleaning around the house and other chores like that. They also complain that I didn't take good enough care of my cat.
How do you feel when your parents say that you are not doing enough in the house?
I feel like they're calling me a lazy son. I really do want to help more around the house, but I lack the motivation to do so.
Did they ever call you a lazy son?
No, they haven't outwardly said it, but deep down I feel like that is the case.
Okay, it's great you're here today. There is ample evidence to suggest that psychological therapy will help to alleviate abnormal feelings and negative thoughts, especially the type we are using today called CBT. I will want you to think about 5 things that will help you overcome these weird feelings. I want you to go home and think positively. Try and change something about your thoughts and feelings every day. Practice these strategies, and I will see you in a week.
Okay, I will try and apply what you have told me here today. Thank you.
Thank you. This ends my first session with my client. Now he's back after 1 week for the second session where we will use EFT, emotion focused therapy. Hi Ben, welcome back. How are you feeling today?
I've been feeling a little bit better after doing some of the exercises that you gave to me.
Great. Last week we learned how CBT could help to change illogical and negative thoughts to logical and positive reasoning. Today, we will use another form of therapy called emotion focused therapy, EFT. This will help to improve your emotions, emotional awareness, and adaptive emotional processing. Emotions can dictate how you feel and behave. Your thoughts and feelings are automatic. Past events and trauma can also affect your current behavior.
I really do want to learn more about my emotions and how to cope with these life experiences moving forward.
Okay, EFT teaches you how to effectively elevate your emotions and cope with life stressors.
Yes, I would really need that because I need to get back to my normal self.
It seems like you're very motivated to learn and get out of these weird feelings.
Oh, yeah, I really do just need to get over these feelings so that I can move on.
Good. Your emotions tells your body how you feel and behave. Today, we will practice Giselle's theory of unfinished business. I will want you to visualize your cat sitting by your side and talking to her while you have your eyes closed and pretend to be caressing your cat. Call your cat by her name and while you talk to her.
Okay, I'll try. Hi, Angel. It has been 7 months since you've left me. It's been a sad and stressful 7 months since then, and I've really missed you jumping over me, kissing me, and wagging your tail. My life hasn't really been the same since you left. There have been times where I've had you in my dreams, but whenever I wake up, I always tend to feel worse. It's becoming more and more real that I'll never have you back again. I love you and I miss you, but I think it's time for me to move on. Goodbye, Angel.
How do you feel now?
I feel much better now. It looks like I'm beginning to let go.
Great. We will continue to build on this emotional awareness next session. When you go home, Think about 5 things again you will do to feel better and do them. I'll see you next week. Goodbye.
Thank you again.
Okay. Now, this is the beginning of my third therapy session with my client. Hi, Ben. Welcome back to your third therapy session.
Thank you. I'm glad to be here.
Did you practice your homework?
Yes, I did.
Good. How did it feel?
Honestly, it helped me feel a little bit better. There have been days where I've had my good times and also days where I've had my bad times, but overall, I still feel a little bit depressed sometimes.
Yes, it may be easy. It may not be very easy, but you get there over time. It seems you want to get back to your normal life.
Very much so, as soon as possible.
Last week, we learned to be aware of your negative emotions and not to let them control your thoughts and life. Today, we will continue to build on that by introducing another form of therapy known as mindfulness based cognitive therapy, MBCT. This involves being present at the moment and observing your thoughts and feelings without judgment. This can help reduce anxiety and depression by letting you accept your worries without letting them control you. Please try this now. Relax. Take a deep breath and observe your fears without judgment. Picture them like leaves floating down a stream. Watch them come and go without trying to eliminate them. Now, tell me, how do you feel?
I feel peaceful and at ease. It feels like a great weight has been taken off my mind.
Good. That's how EFT, MBCT works. Okay, it helps you to get out those feelings. You think about the present moment. Now, when you go home, continue to pay attention to things you do that move you out of depression and anxiety and build on them. You can walk around your neighborhood, go to movies, or visit your neighbors. You can do dishwashing, you can cook, you can sing, you can dance. Just anything that helps you to build on what we learned today. Remember, pay attention to present moment and observe your thoughts and feelings without judgment. This ends our session, and I will see you in a month's time. Thank you.
Thank you so much for being able to help me. It means a lot to me.
You're welcome. This ends my therapy session with my client. Now, summary. Integrative therapy combines different modalities to appropriately and effectively manage our client's mental problem. Those modalities complement each other. CBT highlights illogical and negative thoughts and helps change them to logical and positive reasoning. EFT then follows to improve the client's self-awareness and adaptive emotional processing knowledge. The next complementary modality is MBCT, which combines cognitive behavioral techniques and mindfulness strategies to help individuals better understand and manage their thoughts and emotions to relieve feelings of distress. So for Ben, CBT helped to fight his negative thoughts and convert some of them to positive thinking. EFT helped him understand his anxiety/depression, while MCBT helped him reframe his ideas and develop adaptive coping mechanisms. The three therapies support each other and throughout treatment. My client's parents immigrated from Africa. Knowing your client's cultural background is essential to help the therapist tailor a suitable treatment plan. Most African families have robust religious and family belief systems. Knowing this will create a conducive atmosphere and a good rapport parties for the parties. Ben's treatment progress is monitored through therapy, progress assessment, and outcome measurements. His symptoms, daily functioning, and well being improved over time. Ben discovers his anxiety triggers and improves his coping skills and builds emotional resilience. He recovers and empowers through comprehensive therapy. This is the end of my presentation. Thank you.